Morning. Oh, let me get my morning.
Check your mic.
Good morning. Mm-hmm.
Are you hearing me?
Yes, I can hear.
I'm hearing you coming in loud and clear, Prof.
Good.
Welcome.
Okay.
Dr. Marshall Emmanuel, are you hearing me?
You can hear me now?
Great. I'm coming in loud and clear as well. We're waiting on one more presenter. That's Dr. Andre Horton. Should be joining us in a few minutes. Let us give him a few more minutes, and then I'll get started with the introduction and the objectives of the session. So let's give Dr. McLaughlin, Dr. Horton, a few more minutes. See, I know we're expecting him, so we'll give him another 5 minutes or so. Is that okay with you, Prof? And
Yes.
okay,
Very good. Yeah.
okay, good. Yeah, quick. Tell me in the meeting. Hello? Huh? Okay, sorry. Okay, again, let me pause to welcome Dr. Andre Horton, who is now here with us. Dr. Horton, are you hearing me? I'm trying to. Dr. Horton. All right. Waiting on Dr. Horton to come online. Dr. Horton, can you hear us now?
Yeah, man, I can hear you. Morning, Vicky. Morning, everyone. How's everything going?
Morning, we're good. Thank you for joining us and welcome. We were giving you a few minutes so we can now have an official start to this webinar. Let me welcome all of you who have taken the time out of your very, very busy schedule to have this webinar and this discussion with us. Let me make special thank you to Professor Wayne McLaughlin, who have agreed to do this discussion, and I think it's a very important discussion, and also Dr. Andre Horton, but most of all to Dr. Michelle Emmanuel, who made it all happen, you know, and so thanks for that level of support. I wanted to start out, and I will share, I'll be using the opportunity to share the screen, my screen with the agenda and what we'll be discussing this morning. And so as to give everybody a full understanding of where we are going with this discussion. Also, just to let members know, we are streaming online live on our Facebook page, and that is the ICCR Facebook page. Now, a little introduction as to who is ICCR and what is ICCR about before we get into the main discussion. ICCR is an online, and the name ICCR means Interdisciplinary Center for Cannabis Research. And this center was established out of a grant that we received from the Global Challenges Research Fund, GCRF. And this was done in partnership with the Swansea University and the Global Drug Policy Observatory that has done work internationally on drug policy, including cannabis policy. And the importance of cannabis to our Caribbean region and the wider environment led us to developing the center, because we wanted to have a center that would focus on all aspects of cannabis. And so our center looks at tourism resilience and cannabis. We look at gender and cannabis, the economy and cannabis, and natural sciences and cannabis, public policy, criminology, just to name a few of the objectives, just to name a few, because what we realize is that this plan touches all aspects of life, whether it's economy, whether it's health, whatever. And so when we have regulations that just speaks to medicinal, we're saying maybe we need to look more than just one aspect of the plan. Hence the development of the Interdisciplinary Center for Cannabis Research. We have been working with several members across the University of the West Indies, mainly, as well as international universities. So our team includes our own Professor Anthony Ariot. We have our Professor Lloyd Waller. We have Professor Rosemary Antoine, who was key in doing the work with the Marijuana Commission. We have our own Dr. Michelle Emmanuel, who acts as one of our team members and advisors, Jelani Naya, just to name a few of the members who are part of the team. I have been asked, and I've been working with coordinating the activities of the ICCR as well. And so the idea is for ICCR to really be that hub of policy, of development in cannabis, looking at all aspects of our lives. And so one of the main things that ICCR we looked at was this whole issue of COVID. And we have heard how COVID has affected all aspects of life. And to put it bluntly, the issue of cannabis has also been affected by COVID. We had a certain movement in the Caribbean where we were looking at legalization, regular personal use, regulated markets. In our opinion, a number of those things have been a bit stymied because of the recent COVID. And so we have brought together who we know are experts in Professor McLaughlin, who has been looking at the plant for its genetics and in its entirety, to look at the possibilities of COVID, the plant being used to deal with COVID issues and treatment of COVID. I also, because Prof would have studied the plant, I know Dr. Michelle Emmanuel as well has done extensive work on the plant. As it relates to COVID and cannabis and our economy, the work that has been done by Dr. Andre Orton throughout the years, even before it was fashionable to look at cannabis and the economy, Dr. Horton has done several studies and papers on cannabis and the economy. And so we thought that it is apt to bring him in at this stage to look at that impact of COVID and what are the possibilities for cannabis being sort of recovery industry for small economies such as those in the Caribbean. I want to just pause here to welcome a number of the advocates that I'm seeing that have joined the room as it relates to cannabis in the Caribbean region. We have Ross Miller, who is here, who is in the Eastern Caribbean states. I'm seeing Maxine Stowe, who has played a very significant role with the Rastafari community and the cannabis reform in Jamaica. And so I'm seeing Celia from Barbados as well. So you realize that this discussion is not just a Jamaican discussion, but one that goes across the region. I also know there are persons here from Europe and Africa who are in the room who is listening to our own discussion. So we realize that it's a broad-based conversation. It's not just one for Jamaica, but one that will impact the region and the world. That being said, I want to now just stop to introduce our first presenter, and that person is our own Professor McLaughlin, Wayne McLaughlin. As I said, Prof is a member of the UWI community. He's a Prof, you'll have to help me.
Okay. I think Dr. Horton going out first. Right?
Oh, sorry. My apologies. Let me go back to the agenda because I remember Dr. Horton had in fact asked to go first. So my apologies on that. Thank you for that reminder, Prof. All right, so Dr. Horton, who is an economist in the Department of Economy at UWI Mona, as I said, has done extensive study on cannabis and the economy. His last paper I know was co-authored by himself and Dr. Michelle Emmanuel, along with Dr. Knife, looking at the possibilities for cannabis in the Caribbean region. And so he comes to us with extensive research on the matter of the economic development and the possibilities for small farmers and traditional communities for sustainable development as well. I know he is a proponent of using cannabis as a sustainable development tool. And so I want to welcome Dr. Orton to share with us his whole idea of the impact of cannabis on the economy and on how we treat with the recovery of the Caribbean economies and even economies outside of the Caribbean with cannabis. So, Dr. Orton, over to you for your presentation.
Yeah, man. Good morning, Vicky. Thanks for inviting me to discuss with you the COVID-19 implications on the macroeconomy, especially as it relates to Jamaica's cannabis industry and the role that we have to play. Much respect to my other colleagues, Dr. Emmanuel. We have done a lot of work together. Prof, maximum respect. Now, the COVID-19 crisis has illustrated to us that the world economy is changing in many regards. And this has shown that how we normally go to work where business is concerned has evolved. And things are now moving from just doing the regular economic activities, the regular production procedures, the regular services to know how do you stay close but stay far apart. I think that's the global theme that the pandemic has brought onto us and the region. Now the idea here is that Jamaica has dropped the ball where ganja is concerned. And why do I say that? You would have seen in the news this year where a lot of companies have been leaving. And that is because they have been facing a lot of handicaps in how they operate. The belt that the CLA operates with is sometimes too tight, especially in the initial phases where the people are just getting to understand the business of cannabis production in Jamaica, the business of cannabis output in Jamaica, the business of cannabis value in Jamaica, the business of cannabis value chains in Jamaica. We're still in an infancy stage where the medical cannabis industry is concerned, while we have a mature illegal industry taking place. Now, whenever you have an industry in its infancy stage, the idea is not to restrain it. If you can think about a baby and 2 weeks old, 3 weeks old, a month old, a year old, they have to be ushered and protected. And it's not just about trying to get the baby to walk, to talk at 6 months old, trying to get the baby to run at a year old. It is understanding that it's a baby. So the baby will only be able to do certain things, but will not be able to do others. And I think that is where the fundamental issue comes into play, because a lot of the companies are very small and they still have not found the right rhythm of production. They still haven't found the right rhythm of output. And because a lot of the plants that they're growing have not necessarily acclimatized 100% to Jamaica in the greenhouse setting, a lot of the plants that they're growing haven't acclimatized in many regards, and the diseases, some of them. So the point I'm making is a lot of people, their output has been restrained, and the CLA has not been able to assist them to increase the level of research and development where the domestic production is concerned. Now, as it relates to the economics, remember the output now determines the business and profitability of a lot of these firms. And the output that we're seeing is that many firms have been able to produce something, but they have not been able to really find themselves on that growth trajectory that they anticipated 5 years ago when the legislation was passed to amend the Dangerous Drugs Act. Now, the idea is that we should have used those initial 5 years to set up and establish a rigorous type of research-oriented production and productive activities across these companies, and to give them, so very similar to how, for example, the Chinese get tax waivers when they come here for the first 5 years and they are just buying and selling. Very similar to how a lot of people get these tax waivers. The cannabis industry is an infant industry who should have also been given these tax waivers and given the opportunity to explore their productive efforts. Now, fast forward to 2020, we have found ourselves in these scenarios, and there's not much to be done. A lot of capital have been withdrawn, but a lot of people still coming, illustrating to us that a lot of people still believe in the potential of what Jamaica has to offer to the world. And why not? Because we have a good brand name, we have a good ability to produce quality cannabis that can supply the rest of the world. And it is us who must determine whether or not as a country we want to collectively move forward or we want to get entangled as we have been over the last 5 years or so with ourselves. I think the CLA now, through the help of Dr. Emmanuel, have established some standards, and they did so yesterday. Scarce Commodity has always advocated for standards. We just didn't get the support to really create those standards holistically. Bureau of Standards, I mean, they want to be the standard bearers, no problem. But what you find in Jamaica is that the government and government ministries, agencies, and departments are really trying to take up some activities that can be done by private individuals onto themselves. That is really slowing up the level of output that the industry can have. In America and in Canada, there are many non-governmental organizations that are allowed to do standards, primarily because many of them are more cannabis oriented, and many of them, because the government organizations are spread so thinly across many different goods, many different services, many different types of production processes, then they won't be able to fully focus on cannabis and give it the attention that it requires, especially in its initial stages. When you have an infant industry, the idea is to expand the level of research and development. The idea is to expand the ability to understand that particular product, understand the markets for that particular product, understand the distribution channels, understand the supply channels, understand the backward and forward linkages. Now, what are backward and forward linkages? Backward linkages are those that are coming from the inputs to the industry, and forward linkages is where the final product from the industry goes. Now, cannabis has many forward linkages, and other than the final consumer for the flowers, it can be turned into tinctures, oils, whatever the case may be, and distributed to companies who use these oils now to make production goods and services, as well as other types of material and equipment. Now, the idea here is that transportation is a part of it. The food that the people eat who work in the industry is a part of it. The clothes they wear, the machines, all of this. So the linkage is very pervasive. And we would have hoped that we would find ourselves in a position where we understand the industry to a T, so that we can use scientific judgment and scientific decision making in our business and productive output. But what do we have? We have one man making this here, another man making that there. They're caught in a closed loop with the CLA. There's not much public information available as to where Jamaica is headed. And it's just a sloppy mess. And I've heard owners of medical cannabis companies complain about the rigidity of the CLA, complain about them not being given the flexibility. And it's just because we do not understand the plant. And I think that would have been our first move, to get to understand the plant first with our productive efforts, especially where the medical cannabis is concerned. Jamaican economy was expected to fall by an initial 5% after the COVID-19 crisis. Last week, we heard that it's going to decline by more than 12%. And what this means is that this is going to be the worst decline in the history of the country, and the independent Jamaica, that is. And this is something significant. Now, as an economist, you always try to find out, if we're going to find ourselves in a bad position, what is the remedy? What is the counteraction? What is the strategy that we are going to use to fill those gaps that we have lost? And the idea here is that if the economy is losing 12%, means that most of the industries are being affected. And the only thing that I see that can bridge that productive output gap is this cannabis industry. And why do I say that? We estimated the value of the illegal industry in Jamaica. We estimate it to be about 11.1 billion US per year, assuming that Jamaica's GDP is about 15 billion US. Then the value of the cannabis, which is not calculated mainly, is about 75% of Jamaica's GDP. If we were supposed to roll over, and I see the CLA, they have a transition license that they're trying to implement, but when they implement that transition license, if they're bringing these illegal farmers into this current non-productive, non-expanding, non-exploring system that they have, I think the problem will remain. The idea here is that we have to look at Jamaica, and we have to look at the markets that we can supply to, what we can produce, how we can produce, and how we can move the goods up the value chain. So if you can realize that much of the ganja products that we have here in Jamaica have been basically imported. And it's basically imported because we can't produce as much in bulk as we would like to. And the idea is that we must give ourselves a chance. And what is this chance? Many Jamaicans want the ability to explore cannabis research. Many Jamaicans have been exploring cannabis research. I have several students who write me several proposals on a day-to-day basis of the cannabis company that they want to set up, etc., etc., the products and cooperative structures, So people are very interested. It's just the close-knit, top-heavy hierarchy that we have dealing with cannabis business in Jamaica that has put us in such a predicament. And I'm hoping that we can really wise up very soon and get people in the CLA who understand cannabis to do the work for the country and for the region. Now, let's bring scarce commodity into play. We've been doing a lot of research and a lot of public sensitization and public information forums through our Innocent Plant Symposium, etc., etc. Dr. Emmanuel and I have been across the Caribbean talking about ganja, trying to get the people to understand it, and so on and so forth. We are in a good position to become the center or the epicenter for cannabis in the world and the Caribbean. And what Scarce Commodity has done is that we've analyzed the entire Caribbean and looked at where best to produce what. And the idea is that we want Jamaica to be in a position to be able to earn meaningful income. We don't like the facade. So in accounting, we learn the first principle, substance over form. So many things is the substance of it rather than the form that it takes. And now the Jamaican cannabis industry is just pure form, no substance. So the aim is to really get the little man into play. And we have always neglected him. And until we bring him into play, and I cannot overemphasize why little man is important. The little man is important because he and his grandmother and his great-grandmother, or her and her grandfather and great-grandmother, have been designing cannabis remedies for centuries. And though much of the measurements according to classification and this modern whatever didn't come into play, they use it, what we call in England, eye count. So eye count would have come like feet and yards instead of kilometers. So you're walking somewhere and each step you make, them take the average of most people and call that a feet or a yard, 3 feet, 1 yard. And that was an eye count that came up with that measurement. So though you might have not tested the potency of this and that, the way how these people infuse the cannabis in the therapeutic method, the nutraceutic method, it's not necessarily pharmaceuticals. So we should have some leeway or some legislation in place to assist them to continue what they are doing in a manner, and then now we harvest from them the best of the output and we partner with them to globalize it. And that was the whole idea of scarce commodity. And I think that should be the idea that we push forward for the country. Because if these people are left out, the cannabis industry will continue to be a sham. All these forums that we come to and talk, they'll just be talk shops. And I don't think that the university at this time, given that we are facing so many income problems, so many revenue problems, should be carrying out these talk shops. I think that whatever is being done should be done in such a way that you can partner with these local companies, can partner with these communities, and we have some type of income generating stream going so that the university can have some income. Most universities abroad earn income from patents. They have a few ways. They have alumni, which you don't really have because the alumni don't really feel connected. So some of them participate, some of them, but as it relates to donation to the alumni, you'll get a hall like Taylor Hall, people donate because we're Taylorites. You get Chancellorite donates to Chancellorite. But in terms of you receiving donation like a Harvard, like a MIT, like a Yale or a Berkeley, I don't see that happening. So we have to start thinking about how are we going to earn revenue. It can't just be about setting up centers, seeking foreign funding, and then we try to present a facade to the public and we create all these logos and without the country really moving forward. I'm hoping that this interdisciplinary committee that you have established is not another talk shop. And I want you to now take what I've said into consideration and continue with the great work that you have been doing. Jamaica has the possibility to do well. And as we exfoliate these issues, I think that more and more people will begin to understand what a predicament we found ourselves in now, especially where cannabis is concerned. Thank you for the opportunity to speak this morning, and I hope that you continue to keep up the great work.
Okay, thank you. Thank you very much, Dr. Horton. Some very fruitful points being made, and the warning has not been lost on us in terms of not being another talk shop, because it is important. We have noted, and one of the things the interdisciplinary research center is meant to do is to bring in that community involvement that you spoke about, and not just to become academic, but also to become practical in pushing out policies that are meaningful. We do have time for some questions for Dr. Horton. We'll take about 15 minutes worth of questions before we go into Professor Wayne McClockin's presentation. I'll ask that members use the raise hand feature on the Zoom to indicate that they want to ask a question. So we'll allow for a few questions to Dr. Horton. Anyone has any questions before we move into the next presentation? As I said, please indicate by using the raise hand feature if there are any questions. I know Dr. Horton has put out a number of pointers that I think we need to take into consideration. The issue of standards, he raised the issue of establishing standards for the industry, having standards that are meaningful and that can be utilized at the community level to bring in small traditional growers. He spoke about the value of our ganja industry, what its expected income is, and the value of it being at least 75% of our Jamaica's GDP. That is very important. I know in his innocent plant feature, that a presentation that he brought up again just now, there is an advocacy for inclusion, real inclusion of the traditional growers. And I know he has also said something that I've written down. Jamaica's cannabis industry is more form than substance. So, you know, some of these pointers he has raised. Are there any questions? Anyone has a question for Dr. Orton before we move on?
Good morning, Ms. Hanson. I see a question in the group chat. It says,
Okay.
what does the sugarland divestment impacts have on the small farmer inclusion?
Okay. The sugarland divestment. Okay. Dr. Horton, I don't know if you can relate that.
Good morning. The sugarland divestment. Sugar is on its way out. The value of sugar per acre, the value of sugar per pound to Jamaica is just not feasible. The divestment, I mean, it could not be the case that these sugarlands, the most we could do is use them grow large scale hemp. But I think that the agriculture person, Dr. Emmanuel, can speak more as to the use of these lands. But we need to get rid of sugar. Long time. Long time.
Thanks for that response, Dr. Horton. I think you raised a question, a point, and I'd like to follow up with a question about hemp. I know there is a big discussion within the Jamaican and by extension the Caribbean environment about the value of hemp versus the value of ganja that is strong in THC, medical, what we want, for a want of a better word, medicinal cannabis. Now, could you say something more in terms of the economical value and of us either going hemp or going ganja or just doing both? Is there space for both within the Caribbean region?
All your life, Vicky, you have been raising pigeons.
You're a bit far from the mic, so we're muffled.
Can you hear me now? Am I clearer now?
Yes, you are.
All right. All your life, you have been raising pigeons. And suddenly someone come to you and say, okay, you can raise. I mean, all your life I've been raising eagles. When I use eagle. You sell eagle, you sell your eagle then. Somebody come to you and say, all right, you can raise eagle, you can raise pigeon. Eagle dangerous. You raise some pigeon instead, but you raise eagle 30 years, 35 years, you raise eagle. Then people them come and say the eagle them dangerous, so no raise pigeon. First of all, the pigeon can't fetch as much value as the eagle. That's our first point to me. Second of all, you don't have enough experience with pigeon raising like eagle. So why you going to left something that you have experience with that have a higher value to do something that, because people say more less dangerous, you're going to do it for get less value. You know, I don't think people them better than go grow tomato. The point I'm trying to make is the ganja we know has more value. But that doesn't negate the importance of hemp growing, because most of the products now synthesize whatever hemp. That is why we're saying that we have to establish what we call the Caribbean cannabis economy. Countries like Guyana, who have vast amount of mainlands, can now grow hemp. But albeit, I heard news that hemp is already being grown in Jamaica, being grown in Sri Lanka and some places. So I was talking, this now have nothing to do with it. You just have a good day.
Okay, thanks for that response. All right, we'll take one more or two more questions for Dr. Horton. There's any?
Could I follow up on the Sugarland hemp question? I was actually in St. Thomas yesterday at the Golden Grove, you know, sugar lands. And when you equate the small farmers, then the small farmers are attached to these economies of the sugarland. And in their spare time, they grow the ganja in the hills or, you know, in hidden spaces. So it was curious to me to see the existing Jamaican economy and like the contraction that is expected from the COVID, but you know, that was already going on with the sugar as a mainstay of employment and, you know, for so many hundreds of thousands Jamaicans. This hemp, but you know, because they were telling me that hemp was being grown. They have some 9-mile radius at, on the same property, but down by the sea. And I heard that a lot of the farmers that are taking up the land are thinking that they're going to grow ganja because that's a cash crop, you know, that they can make money from. So this was my curiosity, that politically the politicians have to get these people working. And as Dr. Horton says, the ganja is a economic cash crop, but the land agricultural distribution, you know, related to the small farmer and the economy is, well, it's not clear to me, because when you look at the agricultural availability of land use across all of the products, coconut, banana, etc., you realize that you have you know, I haven't heard that type of conversation about, you know, including small farmers, but within the understanding of agricultural land use policy, and especially with this large amount of land that is now becoming, you know, disentangled from a crop. So that was why I brought it up for the issue of the small farmers, and Vicky also the issue of the hemp, that I see, you know, the problem looming, that I don't, you know, there hasn't been any projection of the agricultural land base in Jamaica as to where this potential ganja is, you know, legal ganja is going to be grown. And so when I saw this divestment, I saw the small farmers, I saw the ideas that they want to get into the ganja, and, you know, see the contradictions with the hemp, and possibly that the lands, I don't know, they had said that sugar had a lot of chemicals attached to the growing of sugar that may have made those lands not suitable, you know. But as Dr. Horton says, there's just not enough information to, even as my mind is inquiring, which is why I'm inquiring of him, you know, what this means, because I think this sugar land divestment is a huge factor.
Very good point, Sister Maxine Stowe, because that brings up another issue that just quickly, Dr. Horton, I'd like for you to touch on in terms of the economic recovery for the industry, the ganja industry and COVID, the matter of access to land. How does that, I mean, we are now looking at these sugar lands, but their availability, real availability of land, and that would have brought into it again something that we have been discussing in the international space, environmental protection and climate change, because we are forcing these small farmers, or they have been growing crops in areas that are designated protected area because of the prohibition discussions before. And now we are moving them out, and we're saying they need to come into the regulatory space. However, one of the requirements from CLA is access to land. I've known a number of the small farmers program that we tried to put on before in another life that I was, that part of the challenge there was for those programs was the availability and access to land. How is that, and how can we treat with that in terms of moving forward for the industry and having the industry helping with the economic recovery for COVID? Is that something we need to look at? Very quickly, Dr. Horton. Dr. Horton, are you there? I'm not.
Yeah, man, I'm here.
Okay.
Economic cannabis has an important role to play in the economic recovery, not just with COVID, but Jamaica's stagnant economic performance over the last 3 to 4 decades. That is what we have always been emphasizing, that the economy has been growing by a rate of 0.7%, sorry, 0.7% over the last 40 years on average. And we believe that the cannabis is the right industry to really effect this change that we want to see. But we have not been managing it well, and I cannot overemphasize that the people at the CLA do not understand cannabis. The country is not a willing country. This government is not a willing government where cannabis is concerned. If you check their history from the 1970s, they have chastised Rasta for cannabis. So it's all just a facade. So I'm just watching like everybody else.
Okay, thanks much, Dr. Arton, for your presentation and for helping us to understand the environment in which we exist in terms of the cannabis industry. Thanks also for the questions raised by Sister Maxine Stowe, because these are real issues that we have to tackle for us to have a successful cannabis industry. The issue of land availability, the issue of how we treat with small farmers on these lands. So again, for us to really have a proper economic recovery, we have to recognize that crops such as, and it is a crop, as much as persons would not want to see it, it's an agricultural crop, but crops such as cannabis is very important. That being said, we now will move into our next presentation, that of Professor Wayne McLaughlin. As I said, Prof comes to us with a lot of experience on the science of the plant, the genetics of the plant. I know he had started out a wonderful work of trying to map the plants within the Caribbean region. And so in that, there has been recent discussions. I know we have been having discussions in the Caribbean region. I see Pancho from St. Lucia here, and I know Dr. Marcus Day and a few others have been looking at what are the possibilities for cannabis for treating. We have a medicinal industry, a medical cannabis industry. It is framed within the region. And so if this is a medical cannabis industry, there probably is the possibility of cannabis being looked at as real treatment. What are the genetics of the plants that can be looked at? How can we use the plant? So we are looking at the plant as helping to solve our economic health, but there's also what are the possibilities of it to be used in a medicinal way, whether it's traditional medicine. And I like to put traditional medicine in there because for years we have had that trust within our traditional communities, the Rastafari and the Maroons and otherwise, of the use of the plant. So here with us to help us understand the plant a little more and understand the possibilities from the plant is our very own Professor Wayne McLaughlin. So Prof, over to you.
Thank you very much, Vicky, and thanks for the opportunity to be part of this presentation. I'm gonna share my screen as I have a present PowerPoint. If you give me access to share.
You have access to the.
Okay, good. All right, let me Great, thank you. Yeah, man, now that I'm up, yes, great. Found it, good. All right, thank you again, and thanks for the opportunity to be part of this presentation, and I want to welcome those who are online. So I've been given the task to give a presentation on looking at some of the possibilities, of course, of cannabis use for treating COVID-19. And this is relatively new in terms of what we're looking at, some of it, the information, but most of it is looking at other areas in terms of how cannabis has been used and how we can relate or try to transform the use of cannabis into treating COVID-19. So I need to give my slideshow. All right, give me a bit of time here. Go into slideshow. Great, thanks, good. All right, so what I'll do, I'll just go through very briefly looking at what coronaviruses are. And as you know, from January, most people should by now know what coronaviruses are. Looking at some of the disease manifestations of COVID and some of the clinical responses to COVID. And just briefly to say what some of the traditional drugs and vaccine trials that are currently being tried. And then, of course, looking at some of the possibilities of using cannabis to treat COVID-19. All right, so coronaviruses, they belong to the virus family Coronaviridae, and these are positive sense RNA viruses. So within the organism, you have DNA and you have RNA. So these are RNA viruses, and they infect a wide host species, including humans, of course, and other vertebrates. They predominantly cause respiratory and intestinal tract infections. And of course, there's a wide range of clinical manifestations that go along with these infections. So in terms of the human coronavirus, of course, they are basically divided into two types, those that are low and high in pathogenicity. So the low ones that, are basically, you just think you have a regular cold, a mild cough, usually upper infections. Now the highly pathogenic ones are the ones that are usually cause infections now in the lower respiratory tract and can of course lead to fatal pneumonia. And as we have been seeing all of that, of course, watching all of that on TV in many of the different countries and luckily for us in Jamaica, we have not really had much of this very fatal pneumonia. So over the years, of course, there have been different outbreaks of SARS or COVID, right? So you have had the severe acute respiratory symptoms, SARS-CoV. That was way back in like 2002, thereabouts. And in 2017, they had the Middle Eastern respiratory symptoms, which is the MERS. And of course, now December 2019, we now have SARS-CoV-2, right, which we now know as COVID-19. So they have been around for a very long time. So these are not recent viruses. And they infect other animals, bats and so. So they have been with us for a while. It's just that it seems now that they are getting even more severe. Now, the disease COVID-19 is caused by SARS-CoV-2, which is now classified, and it's transmitted through respiratory droplets, of course, with the potential for aerosol and contact spread, so touching surfaces, people coughing. Hence, of course, we really encourage persons as I'm on to wear your mask while you're in public. Now, this virus basically enters the body through a receptor called the angiotensin converting enzyme 2 receptor. and it basically ACE2, right? So these receptors basically are found in many, many different tissues in the body. The lung, your mouth, your nasal mucosa, your kidneys, testes, gastrointestinal tract, neurons, glia in the brain. So they are in many, many places. So these viruses basically attach to those receptors, and that is basically how they enter the body. Now, the importance of ACE2, it basically helps to lower blood pressure. Right? So that's why it's found principally throughout the body. Let me go down if I'm trying to go to my next slide. I'm stuck here. Okay, good. So the symptoms that goes along with COVID-19 in particular, it's quite broad, ranging from asymptomatic, so persons can be carrying the virus without any symptoms at all, not even a sniffle or a cough, right? And it's quite mild in some cases, so you may have a cough, a sneeze, runny nose, of course, to the very severe symptoms such as pneumonia, and this can progress to respiratory failure, major organ failure, and of course, can lead to death. Right? So it's really highly infectious. Now, the severe pneumonia caused by human COVID-19 is associated with rapid virus replication. So once it enters your lung, it replicates very, very, very fast. And because of that high replication, your body basically now is trying to defend and protect its cells. So there's a massive inflammatory cell infiltration, and leading to that, you have high inflammatory responses. And these are chemicals that are produced by the body, which are referred to as cytokines and chemokines. So you have a huge response of those chemical responses. And of course, because of those high responses to these chemicals, this can lead to acute lung injury and of course, acute respiratory distress syndrome, right? So the body is basically trying to protect itself. But in doing that, it can lead to serious distress, especially on the lung and your respiratory system. So these cytokines and chemokine responses, basically, as I said, are inflammatory proteins that have been thought to play a key role in immunity and immunopathology during virus infections. So these are basically like the first response to an infection. But because they are really trying to defend the body, it can become unregulated. And as a result, you can have excess immune responses, which lead to immunopathology. So there's evidence from patients with severe disease suggests a role for these hyperinflammatory responses in the human COVID pathogenesis. So what are these cytokines? Right? So there are several of them, so don't worry about the names. Generally, they fall into pro-inflammatory and anti-inflammatory group. But the pro-inflammatory ones are the ones that we said that really ends up causing the body to go into this crisis. So these are referred to as interleukins, right? And they are important mediators in the systemic inflammation. So when SARS-CoV-19 infects the body, of course, results in rapid replication of the virus on the respiratory epithelial cells, and they provoke this acute inflammation and, of course, the violent respiratory disease. Other pro-inflammatory cytokines, so these are called interferons, tumor necrosis factors, interleukins, ILs, And there are several of them. And basically what happens is that the more that they are produced, the more the disease worsens. Right? So what they have found, of course, in the SARS patients, you have a very, very high concentration of these pro-inflammatory cytokines compared to healthy individuals or individuals that are asymptomatic, right? So it's definitely a link in terms of the disease, the virus replication, and the challenge in terms of overproducing these cytokines. So again, as I said, data have been shown that the asymptomatic individuals exhibit lower levels of these pro and anti-inflammatory cytokines. And these results support the notion that higher virus titers and the dysregulated chemokine responses causes what is referred to as this cytokine storm, right? And then this is basically what leads to the distress and, of course, the death of that patient. So, of course, since the outbreak, there have been many trials, drugs and vaccines that are being developed to treat COVID-19. So in February 2020, of course, there were like 35 trials. In March, as you can see, 60. In April, 160. So it has been increasing continuously, over the period because everybody's trying to find a solution. And most of these include antibodies, antiviral agents, RNA-based treatments, and vaccines. So with some of the clinical trials, I just outline a few of them, just to give you an idea of what is being looked at. So Galena, which is a modulator for the anti-inflammatory modulator, right? Immunology modulator, right? Celebrex, so again, it's a non-steroidal anti-inflammatory drug to treat pain and inflammation. Sildenafil, found in Viagra, right? As you know, Viagra treats erectile dysfunction. Right? So you have antibodies, Aldemumab, and again, it targets the pro-inflammatory cytokines. And of course, the one that is very famous, hydrochloroquine, hydrochloroquine, sorry, and it's used to treat these inflammatory diseases. Right? So as you can see, these are all drugs already on the market, and there are, again, many, many trials to see which one could help to reduce the symptoms of the disease, like shortening the disease period, reducing the virus load so persons can shed the virus much quicker and to recover much faster. So these are just, again, all these anti-inflammatory targets that they are looking at. So why not look at cannabis as one of the possible use in treating COVID-19? So as you know, CBD, which is the main non-psychotropic component of the glandular hairs of cannabis sativa, exhibits a wide range of actions, including anticonvulsive, sedative, hypnotic, antipsychotic, anti-nausea, sorry, and of course, anti-inflammatory properties. So it is well known that this cannabinoid clearly can possibly be used in reducing inflammation. THC also have been shown to demonstrate pro-inflammatory and anti-inflammatory effects, proposing that different cells will have various thresholds of response to the different cannabinoids. And so there is a lot of documentary proof that CBD in particular has anti-inflammatory property. So since it seems that inflammatory cytokines, for example, tumor necrosis factor, TN5, interleukins, and inflammatory cytokinins, CLL3, CLL5, CLL10 are significantly upregulated in response to SARS-CoV infection, then CBD could work as an anti-inflammatory agent to reduce the complications by, of course, down-regulating these pro-inflammatory cytokines and chemokines following SARS-CoV infection. So this could possibly, again, as I said, be looked at as one of those tools that could be used to reduce the infection or to reduce the disease outcome. So there are a couple of publications I saw that, going through the literature. And here's one looking at the high CDB extract to modulate ACE2 expression. So remember I mentioned that how the virus gets in the body is through these ACE2 receptors. Okay? And this particular paper shows that especially those cannabis sativa, which are high in CDB, has these very high inflammatory properties and has been shown to modulate gene expression and inflammation and also harbor anti-cancer and inflammatory responses. Right? So this is one paper that I saw looking at how maybe it could block the virus attaching to its receptor to get into the cell. Right? So the ACE2 expression was found in lung tissue, nasal mucosa, kidneys, testes. Remember we said the ACE2 receptors are all over. Right? So by modulating the ACE2 levels in these gateway tissues may prove a plausible strategy to decrease the disease susceptibility. Right? So that's one possibility there. So looking at how we could reduce the virus or limit the virus getting in so you don't have a very high viral load. And so that's one possibility. So how this work was done, basically the group developed several strains. I think they said about over 600 strains of cannabis having different ratios of THC and CBD. So what they would have done is to get the different cell lines, of course, oral mucosa, cell line, lung mucosa, gut intestine, and then they treat that in the lab, of course, with inflammatory chemicals that would cause inflammation, and then look at the responses. So here, for example, a couple strains here on the oral tissue. The strain number 81, number 130 significantly reduced the amount of ACE2 that was expressed. Right? That's the one to the left, epi-oral. Right? Again, other strains did show some response, but not as good as the 81 and 130. Right? And on the right, of course, looking at the gene expression. So the very top on your right, if I could get a pointer. All right, to the top to the right, you can see where there's several strains again with those asterisks over, significantly reduce the expression of the gene of the ACE2 enzyme. Okay? So which is quite key. But if we go back to the slide before, you can see all those strains that were effective in reducing the ACE2 enzyme, they were very high in CDB. So if you look at the ratios, 1 to 27, 1 to 35, 1 to 1, to 31. So clearly it is showing, of course, that those that will work best are those strains that have very high CDB compared to THC. Again, this is the lung tissue. Again, they found strain number 5, number 10, and number 31 significantly reduced ACE2, and you can see the expression of the gene here, where the top, where you see those black marks here, the top would give the level of expression here, which is quite low. So if I go forward, I think all right. So no, go. I'm going too far. Right. So again, with epithelial intestinal tissues, same thing, right? This one, strain number 45, absolutely works very well. Right. Again, reducing the expression of the ACE2 inhibitor. Right? Again, going forward, does THC again does have some potential in immunomodulating properties, and they have shown that unheated cannabis sativa extract again can reduce the immuno responses. Right? So unheated cannabis extract, THCA, right, which is the acid, inhibit tumor necrosis factor, that's TN5, which is a pro-inflammatory cytokine. However, when they heated it, so when you smoke it, heated cannabis, it tends to induce the TN5 level, alpha level, right? So again, acid seems to be much better at reducing inflammation, but once it gets converted, decarboxylated to THC, clearly it does the opposite. Right? So those are the things that was quite interesting. Terpenes, don't forget the terpenes. Several terpenes have been shown to have anti-inflammatory effects. Two such that I've seen, and this is not in cannabis, but on other plants, right? Carphaline and humulene, right? And these are from Cardia verbenacea, which is a plant from Brazil. It's a bush plant from Brazil. Right? The aerial parts of the plant has been used in folk medicine for many years there. It has anti-rheumatic, anti-inflammatory, analgesic healing properties, and in the form of alcoholic extracts, decoctions, and infusions. So it has been shown to have excellent oral anti-inflammatory actions on rodents. This is in the lab. Okay. So these terpenes that have been found in this plant are alpha-pinene, names look familiar, right? Carphaline, humulene, right? And several others that are not in cannabis. But the key ones that I just highlighted, those are also found in cannabis. And this is basically looking at some of the effects of the alpha-humulene on reducing the pro-inflammatory cytokine TN5, and you can see the graphs on the left, quite significant. Carphaline, humulene, significantly reduce the amount of expression or the production of these pro-inflammatory agents. Right? No, so if we look at terpenes in cannabis, of course, we always talk about the entourage effect, and this is really, really key. So this synergy, I think, can be really, really useful to open up new therapeutic products that could possibly treat viral infections, and in particular also COVID. And essentially what it will be looking at is this combination of the CDB plus the different terpenes. And the key terpenes are myrcene, pinene, And you mentioned humulene from that other plant. And of course, in cannabis, you have carfilene. Right? So in also reduces inflammation. Pinene also reduces inflammation. And these have been shown to be even more powerful in reducing inflammation when combined with CBD. So these entourage compounds, CBD and the different myrcene, absolutely, that's something that we could investigate. So in summary, cannabis strain development based exclusively on THC and CBD may be insufficient when we are looking at medically relevant compounds in cannabis. So the research focus on the ability of the phytocannabinoids, in particular CBD and terpenes, to work as an anti-inflammatory agent to reduce complications. And this will basically downregulate these pro-inflammatory cytokines and chemokines following SARS-CoV-2 infection, which is important to contribute to the disease progression. Thank you very much. I give some references here.
Okay, thank you, Prof. That was a very, very informative presentation. It left me feeling excited about being involved in this plant, in the science of this plant, because again, you would have explored and looked at the possibilities of both THC and CBD. And so the potential and the effects of this plant is there for treating inflammatory inflammation caused by the virus. I'm going to open the floor for questions to Prof. McLaughlin on his presentation, because I know there are a lot of questions, Prof. For example, you would have looked at both CBD and THC and its possibilities, along with other agents. We have been told or made to believe over the years that THC doesn't really have any medical value, so to speak. So those are some of the things that misconceptions that are out there with the plant. So again, I open the floor for questions. We have another 15 minutes we can do for questions before we have a wrap-up session with Dr. Emmanuel. So questions for Prof. McLaughlin? And we are also watching the, if you're unable to ask on the line, we do take questions in the chat, typed into the chat. So feel free to type in your questions in the chat as well. Any questions for Professor McLaughlin? Questions? You can also raise your hand in the room. There's a raise hand button, so you can raise your hand. Prof, let me take the liberty of asking a question. In terms of the traditional folk medicine, where I notice you have stated a number of uses of the plant for anti-inflammatory effects. But can it also, so for example, in recent times with the COVID, I've known persons just to prevent COVID from happening, they're drinking cannabis tea. You know, they start, before it happened, I've seen persons who are saying, listen up, I know my mother used to give me cannabis with this and that to prevent cold or asthma. So they are before COVID treatment. Is that something that we, from a scientific point of view, how will we treat with that? Is that something as we as advocates, as we go into this space and hear these conversations, how do we instruct and guide our fellow Caribbean persons as to how to treat with that?
So from the presentation, we're basically looking at, well, two ways, or two of the work that I've seen. One is to block that receptor that the virus uses, right, to get into the body. Right? So that's one possibility, but I think using cannabis to actually block the infection is a little bit more challenging, you know, because those receptors are found all over the body. It's not just in the lung, but it's, you know, most of the mucosa. So to prevent the infection is a little bit, is more challenging to use cannabis. But what is more promising, however, is that if you get infection because of the fact that the virus causes this overexpression of these anti-inflammatory agents, and that is what is leading to the severity of the disease, then, of course, by using cannabis, not just cannabis, you have to look at strains now that with the possibility of combinations of the CDB with the right group of terpenes, as I mentioned, humulene, myrcene, carfalene, would, of course, hopefully reduces that disease period, you know, to get you over that very much quicker. And this is what most of these companies are looking at in terms of the drug developments that they are doing. They want to reduce the severity of the infection. If you notice, they were using anti-inflammatory agents, you know, basically trying to do the same thing that cannabis can do in terms of CBD and terpenes.
Thank you, Prof. In your response a while ago too, I note you mentioned finding the right strain and the right mix. One of the things, as I know, and I've seen it in the traditional community here, we say we have strains of, for example, somebody will tell you purple kush and they give you all kind of names, and they'll tell you, oh, this one is high THC, or that one is high CBD, and so on. How, from a medical perspective, a medicinal perspective, can we determine that? Because again, we're in sort of in between a rock and a hard place where persons will say, yes, I know this is a medical strain and it's high in CBD, or this is high in THC. And we don't necessarily have proper testing. It's just by virtue of their own practices they make. How do we treat with that? And in terms of, you have mentioned looking at the THC or the CBD type with a particular illness, with a particular type of terpene. How do we guard against that kind of open science, I like to call it?
With folklore, you know, folklore is over the many years, you know, so persons will know, you know, which strain works best for certain ailments, you know, which is good, right? But the more scientific way, of course, as you just mentioned, it's to actually have the plant tested in terms of the, you know, levels of CBD or THC, or the ratios of THC and CBD that particular plant produces. But over the years, you know, in folklore medicine, generally they know exactly what ailments a certain plant will be used for. But to be more scientific, as you said, it would be best to be sure by having it, you know, tested for the cannabinoid, the levels of cannabinoids. So you can have repeatability and you can guarantee that it will work all the time.
All right, we have a question from a colleague in Morocco, and she's asking, Dania Petri lives in Morocco, but she has done work in Europe and in the Caribbean as well. And her question says, it looks like the main discourse in modern medicine does not provide much space for herbal cannabis. Can you give recommendations for how we could challenge this discourse? For example, what kind of research could we do in order to explore more holistically the holistic potential of cannabis, especially in the context of COVID-19?
Right. So it is a challenge, so in most herbal medicines, because they have so many different compounds. And, it's always saying that it's hard to do a clinical trials because that might vary, the next lot or the next crop is gonna vary from, one day to the next or from 1 year to the next. But my thought on it is that if you have strains that you have really characterized, you have done a lot and consistently given the same chemical profiles, you're gonna have minor cannabinoids that you may not detect, of course, minor terpenes, minor flavonoids, you're not gonna take. But if you have the major ones, I think we could stand a chance of getting clinical trials done to show, the efficacy of using herbal medicines, and in particular also for cannabis. So I think if we go that route, as I fully characterize certain strains, and you have all the chemical profiling, then you stand a better chance of getting this into clinical trials. And they have done that in some instances, which is something that we should aim for.
Thank you, Prof. You mentioned clinical trials and having the right profile, but that brings me to the whole matter of training and development, even for what we've called and we've seen developing called the naturopaths and the herbalists within the medical or the traditional medical field. And I guess my follow-on question to Daniel's question is there, I know you have done extensive work. I've been in the region and I've heard your name in Antigua and in St. Vincent. So I know you have been there and you have been working with the traditional farmers, mainly to kind of build a profile of the plant and mapping, the genetic mapping. Can you tell me, is there a possibility to engage in training for these persons? Because I know of, for example, locally, there is within the GGPA group, and I see Mr. Paul Burke is in the room. I know we have herbalists within that group who have said to us for years they have been doing this, they have been treating patients and they've been doing that. Is there a way for formal training and recognition and some sort of certification to what the science allows?
Well, yesterday, as you know, the Bureau of Standards launched, I think, 5 standards. Hopefully, they can, really be used. So that is a good start, because you want to be able to repeat things, doing it the same way every time. And that is one way of getting your records right. You have a strain, you can track it from, every seed you put in. So these are things that they're gonna look at, So that is where the training could come in, to essentially get the farmers to really understand what they are doing. They know what they are doing, but I mean, it's just to get proper records in place, traceability, that somebody come to inspect, you can pull a record and say, this is a strain that we planted last year. This is the same profile we got again. Those are the things, those are the areas that can really get the farmers to really get going on, and that will help in a long way.
All right, thanks, Prof. Any other questions coming from the group? As I said, please, you can drop them in the chat if you're not able to speak in the room, or just give us a raise hand so we can acknowledge you and ask the questions of Prof. McLaughlin. I'm not certain how soon we'll have a scientist of his caliber to ask these questions again, so please.
There are many coming. There are many up and coming. Making sure we are training those.
Right.
Just to say that, some of the work we have been doing basically, again, as you mentioned, the characterization. So, looking at the genetic profile, looking at the genes that produces THC, CDB. So you can even get that information even before the plant start producing flowers.
Yeah.
So you know that this is a possibility of a high CDB producer, high THC. We know doing terpene profiling, so we can look at the same strains with their terpene profiles. And consistently now we have been finding we're getting repeatability, in the output of the different cannabinoids and terpenes. So this is basically what we're trying to do.
Very exciting work, Prof. McLaughlin, and I'm glad it is being done within the region. And I can say based on the work that we have seen in the Caribbean and in other parts of the world, the Caribbean is in fact leading with some of these research and has led over the years with some of the research and studies in cannabis. So it is good to just know that persons like yourself have engaged in the process of ensuring that the science is done. And as a research center, this is our part of our objective is to bring these work, these studies, and so on that is being done within the region to the fore, to forums such as these. We have had to do webinar because of the current COVID virus that we are in, but it is good to know that we can bring this discussion to the table and bring it forward. Okay, I am not seeing any other questions, but we will allow for questions a little later with other persons. Should persons want to ask questions, we will allow for some questions later, Prof, if you're so inclined, once persons type it in the room. What we'll do now is another scientist I will bring to the fore in the form of Dr. Michelle Emmanuel, who has done some work, extensive work as well, on the science of the plant. Dr. Emmanuel is, as was noted by Dr. Hart before, has written extensively on the economics as well. He's a botanist. I know I had the very good opportunity to visit his lab sometime earlier this year, and it's an exciting place. He has done several work within the region. I know one of his latest achievements is to help with the development of standards as well through the Bureau of Standards for the industry. And so I will leave the wrap-up session to Dr. Emmanuel, who will tell us more about the work he has been doing and to kind of summarize the issue of COVID-19, whether it's economic, whether it's its potential for medicinal, and look at how we can move forward, what more we can do in our various spaces within the region, within the Caribbean, because we do have persons here from the Caribbean, we have persons here from North Africa, we have persons here from Europe, we have persons here from various areas. I'm seeing persons from Asia as well. So Dr. Emmanuel, over to you to just kind of give us a wrap up, and we'll leave another 15-minute session after your presentation for questions and final comments. So over to you, Dr. Emmanuel.
Yeah, Vicky, thank you very much, and greetings to the panelists, Dr. Horton and Professor McLaughlin, for your contributions. It was very informative, especially Prof's McLaughlin presentation, looking at the more depths in terms of the science of COVID and the medical potential for treating COVID symptoms with cannabis. And what really, and I would also like to thank the Interdisciplinary Center for Cannabis Research and Miss Vicky Hansen for putting on this seminar to continue the public education forum to educate personnel of the potential that we have within the Caribbean region in regards to developing a cannabis sector. So thank you very much. And all the guests from various countries, I see Mr. Paul Burke there representing the Ganja Producers Association. So it's good to have these people here to listen into such an informative presentation. So my presentation today, I will basically look at what's happening within the context of Jamaica and relate this to the Caribbean region and the potential that we can definitely play in terms of creating a cannabis economy that could definitely bring some sort of economic viability and sustainable development within the Caribbean region. So within the context of the Jamaica situation, we have the Cannabis Licensing Authority and the Dangerous Drug Act, which was passed five years ago. And just to bring up to date, so far the Cannabis Licensing Authority has granted more than 60 licenses within 5 different categories, which is definitely commendable based on the convoluted navigation that had to take place in the interim stage to develop such a vertical integrated industry thus far. And that does come with some challenges. So we have seen where the hemp policy has yet to be gazetted, and there has been a lot of discussions surrounding coexistence of hemp and Jamaica's potential to produce ganja versus hemp. But you see where cannabis is such a dynamic plant where you can't really single out cannabinoids per se, but it needs to be an integrative approach to the production and the approach towards the value chain in regards to cannabis, from production to processing to packaging. So the discussion around the possibility of coexisting within hemp, and I'm sure that everybody knows now that the government has made it very clear that they are not pursuing industrial hemp, but more so craft hemp, where it's growing cannabis inflorescence for its CBD potential. And within the Dangerous Drug Act, it classifies hemp as any cannabis plant that has less than 1% THC. That does come with some challenges also, because some global jurisdictions do classify hemp as 0.03% THC. However, as Prof. McLaughlin has demonstrated, that the dynamism that the genetic potential that cannabis has to display the variation in terms of ratios of major cannabinoid profiles versus minor cannabinoids, it is in the interest not to limit, but to really continue exploring and carrying out the research based on the ability to chemotype and to properly physiologic and to proper characterize particular cultivars based on their physiological and morphological and chemical characteristics. So we see where the export policy has been taking some time, and the promise in terms of announcing that these standards have been coming has been for some time now. And I think this is one of the contributing factors where we see that Forbes put out this article recently concerning that the level of foreign direct investment, which is possibly pulling out from Jamaica currently due to the stall of the capability to export cannabis. And with that said, they have put some interim measures in place, and they have assured the general public that as long as there is an import permit from an importing country and the willingness to import cannabis from Jamaica, the Jamaica government and the Cannabis Licensing Authority and all the supporting agencies are willing to explore and support such a venture. So I am sure too that the COVID-19 situation, which is definitely affecting investments globally, has definitely contributed to the current situation in regards to investors not committing to some of the bargains that they committed to previously. And it's fair enough, because we see that the financial meltdown globally in regards to the COVID pandemic is definitely tremendous. So yesterday, the Bureau of Standards Jamaica launched 7 standards. 4 standards were adopted from ASTM, and 3 standards, the cultivation standards, the processing standards, and packaging and labeling standards, were developed domestically, with really reviewing all the international standards and how we could really tailor these standards to the benefit of the local capacity, and developing that capacity locally, that Jamaica could meet or exceed criteria for exporting cannabis globally. So we commend the BSJ for putting together this committee 2 years ago, and I hope that the public education drive to educate the personnel in regards to the possibility and application of using these standards to their own personal development could go a very long way in ensuring public health and safety and environmental stewardship is practiced throughout the value chain. And then we see where Rastafari generally has really piqued an interest based on the sacramental rites and how this situation has been handled 5 years on. And a public notion from the Rastafari community is generally that sacramental rites does not necessarily give them that right to any sort of economic interest from sacramental rights. So these are some current developments that has recently took place, where we even see the CLA putting together an interim permit to facilitate some of these traditional cultivators to participate within the legal framework. However, as Dr. Horton said, the situation for traditional farmers to really participate within the legal framework is way more challenging than just reducing the price of entry and the price to develop the requisite infrastructure for security requirements. Definitely, traditional farmers' capabilities go way further than that, and the onus is definitely to do a proper evaluation of these traditional cultivators to see what are the challenges that they face and what is the possibilities and the capacity and training that is required for these traditional cultivators and processors to participate within the legal framework. And within the whole context of medical cannabis, which we see is consistent towards the cannabis reform regionally, where the Commonwealth Caribbean is definitely looking towards that medical cannabis regime. And from what Prof. McLaughlin mentioned, medical cannabis simply composites the value chain of being able to grow a particular cultivar to a specific cannabis profile consistently to generate oil or some form of processing, and by doing so, using that consistent method to make medical formulations such as tinctures and medical products. And the value chain needs to be definitely, consistent from chemotyping that cultivar, knowing how that cultivar grows, by stabilizing it and allowing it to produce these phytochemical constituents consistently, by extracting these same flowers to get a consistent ratio based on cannabis oil, and by using that to make your dosage specific formulations that exceed public health and safety standards, is critical to understanding the application now of administering these particular compounds that are able to replicate consistently. And this is very important in a value chain such as where raw material is basically king. So how we treat the raw material from production, style of cultivation, nutrients used, other genetics used is going to be critical to the service of the value chain upwards in regards to processing and making medical formulations. So within the Caribbean context, we have seen where reform has definitely been taking place based on government's agendas regionally. And we see where Jamaica took the lead in 2015 and is followed presently by St. Vincent and the Grenadines, where they have developed and implemented policies that are in motion, that are currently guiding that process towards developing that capacity for producing cannabis and serving certain criteria. It challenged me to say that the current reform policy that the region is really looking forward to, based on creating an internationally export-oriented sector, does pose challenges for some of the small, well, all of the small countries within the Caribbean dispensation, where the capacity, because when we look globally to see what sort of exports being taken place within the global space, we see that the quantities and the value based on these exports have superseded based on $1 million in some instances. So to really generate that capacity based on providing that level of quality assurance throughout the value chain is going to be critical, based on the region's capability to participate within the global framework. And one of the challenges that we've seen globally based on some of these exports taking place is the possibility of sanitation. How do we sanitize cannabis that we ensure that these countries that would be receiving the horticultural commodity in its raw state does not have particular pathogens such as fungal spores, such as insect eggs, and so forth. So in terms of sanitizing, this needs to be based on a sort of public-private partnership or public to really service the general sector based on that, capacity, and then the quality assurance based on the testing capabilities, based on the infrastructure that is currently required to facilitate commercial exports. Based on that value, we need to really invest significantly based on building the competence and the infrastructure with a proper instrumentation that could definitely generate that, capacity within the region. And within OECS or within the Caribbean region, it's a very integrated process where I believe that intra-regional wealth could be significantly generated from intra-regional trade. And we've seen where intra-regional trade has definitely been its lowest for the past 25 years. And now we have a horticultural commodity in its raw state that does catch the highest value for like horticultural plants within its raw state within the region. And sometimes the domestic prices really fetch higher prices than international prices. So we have known that we see where Jamaica, St. Vincent has definitely taken that lead. But if you look at the history, Jamaica and St. Vincent have also been traditionally known to be the cultivator type countries that have produced cannabis based on generations. So they have participated within the illegal value chain for the longest period. And then moving on, as Dr. Horton said, you have countries like Guyana and Belize that has a history of large agro enterprise in sugarcane and rice. And they have the flat plains to really explore the possibility of hemp production. And when you look at Guyana and Belize, it is amazing to know that they also have had established hemp, committees that have been established a while ago that really has seen the potential of these countries to produce hemp. And this leaves me now to look at Trinidad, where Trinidad has always had that, capacity based on manufacturing goods, based on the region, based on the competence and the infrastructure and the low energy consumption bill that has really contributed to Trinidad being the manufacturing hub. And then this leaves me to say that the smaller island states within the OECS, such as Antigua, Barbados, St. Kitts, they have pretty much been known within the region to be consumer markets and are blessed with possibly a lot of a very consistent tourism market, which we see it has been significantly impacted due to COVID-19. So by servicing the 40 million people that we have within the region and facilitating that intra-regional trade by reducing the trade barriers that may exist internationally, I believe that within this framework, the Caribbean region could be a more forceful trading bloc to participate within the global framework in terms of cannabis trade. So when you look at cannabis reform globally, we see that definitely one size has not fit all. And every country has been tweaking legislation to really look at what sort of interests domestically could be benefited by looking at the more global picture. And so because of that, it is definitely the business of cannabis has been a very dynamic one. So we see that the establishment of such a center, like the Interdisciplinary Center for Cannabis Research, does help to facilitate the different components surrounding cannabis, from law and policy to science and medicine to the business management side to the history and cultural side of things. And this is a sort of holistic approach based on the development of such an industry that forms forward, backward linkages, and even side linkages within the value chain. So how do we now develop such a framework where not just domestically individual countries would benefit, but how do we sustain that sort of development by facilitating the research, by building the infrastructure, by building that human resource competence that is necessary to facilitate that capacity for the region and the individual states to participate globally. This is very critical. So the building of such a sector really needs to focus on these things mentioned. So within Jamaica's context, which I have more experience looking at, we have seen where the implementation of the Dangerous Drugs Act 5 years on has definitely seen some progress, but there is still a long way to go to really reap the benefits that have been set out from a more holistic and sustainable basis. So we've seen where the conflicting agency visions don't seem to create that cohesiveness in terms of moving forward. And just to mention, we have the Cannabis Licensing Authority, we have the Ministry of Health, we have JAMPRO, we have the Ministry of Justice that looks and governs particular aspects of the Dangerous Drug Act, but we have not seen the amends and that cohesiveness based on these agencies, based on moving forward with the development of such a sector. Then we have looked at, based on the impact of the product approval process, based on THC classification, based on more evidence-based medicine coming out, where the Ministry of Health really guides that process. And we've seen where the Dangerous Drugs Act did not define definitively what are cannabis products, and it's causing a bit of ambiguity based on edibles, based on vape pens, based on how do we administer these formulations or this value added products within the framework based off the Dangerous Drug Act. So then we've seen where the due diligence process has definitely been taking some time for some companies, where the supporting agencies, which maybe both locally and internationally, have definitely contributed to that frustration. Then at a seed to sale tracking system, where how do we monitor the process based on the production, processing, packaging, labeling, and dispensing cannabis, particularly for the area of voluntary and mandatory recalls. Internationally, we have seen where the major cannabis companies have been receiving a significant number of recalls based on cannabis products that people may be tending to use for particular health reasons or so. And So how do we now treat the process of monitoring and really capturing that seed to sale tracking system? And we have yet to really come up with a proper solution to really govern that process properly. And by monitoring, this will ensure that the producers, the processors really comply with these monitoring for environmental stewardship and public health and safety standards. So it is commendable that the Bureau could really prepare and gazette and publish these standards, which would definitely guide the process. However, these standards are involuntary standards, so it is not mandatory that any producer really complies to these standards. It is based on the regulator to make this within the regulatory framework. And we have seen where 5 years on, we are still operating based on interim regulations. So moving on, how do we protect this sort of local ownership based on the cannabis industry that we are developing? We have seen where Prof. McLaughlin just displayed a range of possible combinations of major cannabinoids of THC to CBD. And this is very alarming to me because the particular ratios that show potential for inflammatory prospects based on treating symptoms of COVID-19 is relatively low major cannabinoid ratios from 3 to 2%, 4% THC, CBD. And this really strikes out to me because many of the local and regional cultivars that I have worked with based on their cannabinoid ratios tend to reflect some of these cannabinoid ratios that have been presented for a potential for treating COVID-19. However, if you visit any of these dispensaries, it's mostly high THC stuff exceeding 18% THC, so forth. But recently, some studies has looked at based on these low cannabinoid profiles and possible for treating medical and therapeutically. So many of these strains and possibly terpenoid profiles based on myrcene, limonene do exist locally. So how do we now conserve and protect the germplasm that we have that have significant physiological and morphological implications for cultivating within the region? Whereas we have seen where cultivating a local cultivar that really has been classified as a narrow-leaf drug type that has the physiological capabilities of a long flowering time, which are the type of cultivars that have acclimatized for equatorial cultivation. We have seen where an area of one bed of 4 feet by 30 feet can produce or exceed up to 14 pounds of biomass from one bed, compared to these modern day hybrids that would have 20% THC. You would not get possibly 3 to 4 pounds base of biomass being produced there. But maybe that these landrace cultivars may not possess the aesthetic presentation of the modern day buds, but definitely if someone is going to extraction or major and minor cannabinoids, cultivating these type cultivars has definitely proven to be more economical based on their physiology. They grow within the tropical climate. They produce significant more biomass with less inputs being administered. So you will definitely get a better return for your buck by using much more less energy within producing these particular cultivars, which definitely generate significantly more biomass compared to these modern day cultivars, and had a cannabinoid ratios and terpenoid profile along with the flavonoids tend to be unique. So how do we now really continue that research of how do we classify, stabilize, and really can produce genetic material that could service the region based on potential for cultivating, based on economic value, and sustainability is going to be critical to how the region perceives tropical cultivation, right? Because cannabis is very dynamic. Humans have cultivated cannabis for a very long time, but because of its isolation between different climates, the plant has acclimatized tremendously to particular geographic locations by exploiting and modifying its physiology and morphology based on being more pest resistance, puts on a larger stem diameter to support more weight, so you won't have to stake up the plant. So there are many benefits that could be arrive from looking at the possibility of characterizing, conserving, breeding, and really producing particular type cannabis that has been proven along the value chain right up to producing a medical formulation that could be produced based on a dosage specific level. Within the Jamaican context, we have seen where the public perception based on the point of sale we have seen where earlier to this year where the Drug Council sent a ghost person into these dispensaries to explore what has been taking place. And I have been myself, and I have seen where like the question based on medical, recreational, what is really taking place within those dispensaries based on seems to be more leaning towards a recreational side of things, but not necessarily that tried, proven medical and therapeutic value based on quality assurance standards and creating those type of public health and safety produce cannabis that really fits particular criteria based on consistent cannabinoid ratios being administered on a consistent level. And we've seen where the advertising and marketing was not really included within the regulatory framework, and we've seen where these local dispensaries have basically put on puff and paint events. We have seen where they use dancehall artists to be brand ambassadors, featuring some of these dancehall artists and the cultivation and processing within music videos and so forth. So we are not sure what type of message that this would be sending within the global community based on facilitating a medical cannabis regime locally. And we have seen where the enablement of the legal tourism sector has yet to be really developed to really capture that level of tourism coming in for wellness and the therapeutic value of using cannabis whilst on holiday to help relax and enjoy your vacation some more by creating that aura around cannabis tours, cannabis consumption. And yeah, so how do we enable this wellness related tourism within the facilitation of the dangerous drug that and the current regulations that we have? And as I mentioned before, the traditional permits that have been set, they're based on what I have read thus far, there seems to be some limitations based on the capacity that these traditional cultivators could contribute to these value chains, such as communities like Slipe, such as Orange Hill, that have been doing this for a very long time. They have more significant challenges to deal with based on land ownership, based on the germplasm, based on technical capabilities to record keep and produce cannabis based on a sustainable and environmentally basis, and really administering public health and safety by doing so by protecting workers' rights of sanitation, protective gear. All these things needs to be understood carefully based on the capacity that these traditional cultivators could play within the legal framework. So I think more research needs to be done for that to happen. Thank you very much.
Thank you very much for that wonderful wrap-up and presentation, Dr. Emmanuel. I am going to open the floor. Before I do so, I realize your presentation and wrap-up touch on very important points. You looked at the value chain, and that is important. And I'm twinning that with Professor McLaughlin's presentation earlier. So we look at the raw material and the potential of the raw material. What can we get in terms of anti-inflammatory agents coming out of those, and that adding to the value chain? We touched on that. That's very important. And the exploration, you went across the region, which is important, looking at countries such as St. Kitts, St. Vincent, and the Grenadines, the potential for consumers. Tourism, wellness tourism, something that has been pushed within the region, and cannabis will play and should play a key part on that. That can be twinned with Dr. Orton's presentation earlier that looked at the economic possibilities coming out of cannabis to help the countries of the Caribbean region recover, and even those in Africa. You look at the Dangerous Drugs Act, and that is something I flag here, and I'm glad that, as I said, Mr. Paul Burke is here, because that is something I know he has advocated. Do we need an amendment to the Dangerous Drug Act, or should we be looking more at developing a Cannabis Industry Act that we can now include, not just the whole issue of medicinal? Something that you alluded to is our trade, but the trade in cannabis and within the international space. But that also needs to be looked at in terms of the whole matter of fair trade, the whole matter of the UN conventions, because you mentioned that with standards, we're looking to develop standards, but are these standards that are acceptable within the international environment that we can use? And I'm hearing coming out of your presentation as well, the importance of climate and environmental regulations and the use of cannabis, how cannabis is treated within the environment, and it's important to climate and climate change. Something that I think is hardly looked at when we look at the whole cannabis industry. So these are some of the points that we would have flagged. I'm going to open the floor up for questions coming from the audience. I see Paul Burke wants. Go ahead, Paul.
Good morning, Vicky. Good morning, everyone. Sorry I came in late. Very impressed with Professor McLaughlin's presentation, but I want to direct my concerns and questions to Emmanuel. But Vicky, are we going to get copies of these presentations?
Yes, I'll send the presentations to you. We'll ask for them from the beers, and just so you know, the session is being recorded, so we'll send snippets of pointers to you as well.
But some of us need to read it, you know, to really internalize it and remember it. Can't absorb so much.
Yeah, I'll ask Prof. McLaughlin to just send us on this.
Yeah, I will send it out. Yes. Good.
Yeah, Dr. Marshall, the Ministry of Health. Well, first of all, you know that the food and nutraceutical policy has been in front of our committee, I think, for about 10 years and still not gazetted, right? So that holds up the whole nutraceutical industry. And the Ministry of Health, my interaction with them up to January, February of this year, even things that are CBD. And I understand there are certain regulations, labels, standards, etc. There is a tremendous difficulty to get approval. So technically, there are hundreds of products out there, many not approved by the Ministry of Health. But if you want to get approved by the Ministry of Health, it is a long, drawn-out, difficult, tedious process. And the edible industry is a big part of the cannabis industry. So what is happening to us, rather than having some even basic regulations to guide the industry, we really have nothing much out there. And we have literally forced hundreds of entrepreneurs, some with good products, some with not so good products, some not even knowing because they're buying different strains of cannabis ganja with different levels of THC, what they're putting out there. How do you see it? How can we resolve this urgent and important matter of edibles, the Ministry of Health, nutraceuticals?
Yeah, Paul, thank you very much for that comment, you know, and this is a very important question because that has raised many eyebrows within the whole framework that we have set up based on cannabis. And as Vicky said, just the fact that we have an amended Dangerous Drug Act does not really set the right precedence based on the name, right? And we've seen where other regional jurisdictions has definitely looked at Medical Cannabis Act and so forth, removing that stigmatization in regards to classifying it as a dangerous drug, right? Then we have seen where the laws that could facilitate cannabis based on the Agricultural Act, based on the Health Act, based on the Pharmacy Dispensation Act, these acts have definitely been outdated and does not really encompass that fact of herbal medicine, which is really what cannabis is. And we have neglected that nutraceutical and herbal therapeutic aspect within the administering, within the context of the law. And this is one of the reasons why it's possibly stifling that capability for a traditional medicine, for naturopath, for the application of particular types of delivery methods, such as edibles. But to flip the coin, on the other side, you want to ensure that public health and safety is also administered with the greatest care, right? And we have seen, based on what edibles has definitely done within the global space, and even locally, where Jamaica does not have a thriving CBD market, where most of the cannabis that we grow tends to have higher concentrations of CBD, no, of THC to CBD. So that psychoactive capability of consuming cannabis orally has to be done in a very pragmatic and strategized and way that would ensure proper dosage specific products come from these products being produced, and it can be supported by properly by proper quality assurance testing that could assure these customers that when they consume 10 milligrams of this product, this is what they should expect consistently. And based on the infrastructure that we have presently, where there is not a single house that we could go to get the health and safety testing requirements based on heavy metals, based on pesticides, based on cannabinoids, based on terpenoids, we have to shop around. And sometimes if one equipment is down, it pretty much stalls the whole process. So how do we now really fix this problem based on how do we build that infrastructure and instrumentation and local capacity that could facilitate the confidence within the consumer in consuming edibles? I know it's a very good delivery method, but if you look traditionally and people make brownies, it is not done consistently, and sometimes they tend to make it the strongest, which is not the approach for an edible high, right? So an edible high really should not exceed sometimes 20 milligrams of the psychoactive component, right? So how do we now regulate such a thing that the public health and safety is paramount based on the application of administering such?
Thank you very much. Thank you.
Any other questions for Dr. Emmanuel or even Prof. McCloughlin? All right. I note Dania had posted and has posted within our chat room an article that says sharing related to traditional healing practices involving psychoactive plant and the global mental health agenda, opportunities, pitfalls, and challenges in the right to science framework. So that's a very important article. I think persons can access it from our chat, and we can read through and just pick up on some ideas and some policy issues coming out of that article. Any other questions for Dr. Emmanuel or Prof. McCloughlin? All right. Let me thank you all for joining us on this very important webinar. Let me thank Dr. Andre Orton, who had to step out earlier, and also Prof. McCloughlin, who I know has indicated that he will share his very important scientific presentation with us so that the group can get it. So when we speak about the possibilities of cannabis from a medical point of view, as it relates to even COVID more specifically, we can speak from an informed position. And this is an issue that has, as I said, came out of a regional discussion that persons are looking at. We're looking at a medicinal cannabis industry. What are the possibilities? We have a major pandemic on our hands, and is it something that we have to look at in this industry that we are looking to develop? I want to thank Dr. Marshall Emmanuel. He has into several areas: the economic, the social, the regional, and the various possibilities and potential there for us to explore. And most of all, I want to thank our participants. We have had participants coming through from the Caribbean regions: Antigua, St. Lucia, St. Vincent and the Grenadines, Barbados, Trinidad. I've had the participants coming out of Africa. I've seen members of the Hemp Association from Ghana came through earlier as well, and also from Asia, I'm seeing Dania from Morocco and from Transnational Institute and IDPC, which is the International Drug Policy Consortium. So we have had a wide audience. Renee was here from Europe as well, from Amsterdam. So we have had a wide a range of participation, persons listening to our conversation. And what the Interdisciplinary Center for Cannabis Research wants to do is to become that hub that pulls these conversations together, pulls these policy papers together, pull the experts together. And as such, Prof. McLaughlin, we're extending a hand for you to come on board and assist us with those conversations, because I know the work that you have done in the region goes beyond just Jamaica and the Caribbean. Persons have looked at the work that you have done in the international space. And we're pulling, as I said, cannabis is more than just a plant that is just on the scientific side. And the Interdisciplinary Center is meant to pull all the issues. It has a gender component to it. It has a social and a cultural component to it, scientific, as we have said. And so it is pulling all these studies, all these research work together to become that hub, that policy hub. I know it's something that you, Paul Burke, has mentioned over there, how to access what is happening in the space and having that center where you can pull this information, this data, this richness of policy, and we can use it to influence our own local space. And that is what we're aiming to become as a ICCR. So again, I thank members all for their participation. You can look at our website. The discussions from this will be placed on the ICCR website. We'll also try and circulate by email and through our Facebook pages. We were live on our Facebook page, so we have a Facebook page. And we'll be sharing as much as we can. We'll be getting the studies in. And we'll be doing our own research work as well. We're looking for funding to continue the research work, because what Dr. Horton said earlier is that we want to become more than just another talk shop. We want to be that center that helps to pull the research together. So again, let me thank you all for your participation. And I think we did very well on time, because we are now finishing at 11:29. So looking forward to sharing more with you all. Thank you, thank you, thank you.
Good.